meeting time for the CEO Performance Review Committee. So I'd like to welcome everyone here. Thank you, gentlemen, for setting all this up for Metro. Appreciate y'all. You picked the wrong one. Usually if you come for the committee meetings, you get lunch. So you need to volunteer on those days. So we'll start with a conflict of interest. Is there anybody here that needs to disclose a conflict of interest? Seeing none, we'll proceed to the next, which is the mission statement. Mr. Lester, would you be kind enough to read the mission statement?
The NGH mission statement to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice. Thank you.
Ms. Lester, is there any public comment?
No, ma'am.
Okay. Moving to the next item, which is the minutes. If everybody's had a chance to review the minutes, are there any edits?
I move approval of the minutes.
Second.
Okay. All right. Any discussion? Seeing none, all in favor?
Aye.
Motion passes. Next item on the agenda is the new business for the fiscal year 26 CEO objectives. Being that today is July 31st and still technically July, I would like to hope that we can get these CEO objectives and performance assessments completed and hopefully finalized. I know a lot of work by this committee has gone in to try to get this to be a timely event going forward. And so I applaud each of you in your commitment to bringing new ideas to the table, reading these. Also, thanks to our interim CEO, Dr. Elders, who has also worked to provide feedback and defining criteria in this performance assessment. So I do think it's a really good start to, what we will be able to continue to evolve moving forward with this committee. The other kind of pending item on terms of collaborative efforts, I know that Ms. Lester had reached out and is still working to obtain some other CEO performance evaluation data. So the forms that other hospitals, as an example, and other safety net hospitals might be using. So I know that that's still in the works. So again, we'll continue to evolve as we move forward. So thank you again to everybody who contributed. Not to belabor the point, but for those listening, all of Nashville listening, just wanted to run through the how this works. So we have 5 specific areas that are used to grade the CEO to define the bonus by fiscal year end performance. So that would be a bonus of anywhere from 0 to 5% in bonus structure. Those categories are based on growth, financial leadership, quality of care, and customer service. This category by this committee has evolved to incorporate both quality and customer service, since many of those overlapped. The employee excellence category is a new category that we've added because we believe so much in employees here and making sure that they're the culture is strong. The other category is board member and stakeholder relationships. So those are the 5 categories. Each category has a scale of 1 to 5 that can be rated, with 1 being unacceptable, 2 developing, 3 meets, 4 exceeds, and 5 consistently exceeds. Once people at the end of the year, once each committee member has an opportunity to evaluate the goals and objectives against the actual measurement criteria for each category, they would rate on a score of 1 to 5 for each of these categories. Depending on the number of committee members, those scores are tallied, divided into 5 tranches, and then each of those tranches would be assigned a corresponding bonus percentage of 0 to 5. So that's the scoring criteria and how this would work. The first category area is growth. We have evolved each of these categories over the last couple sessions together, and the initial, the draft form of the assessment form was sent out to committee members for their input individually back to Ms. Lester, and then those were incorporated in this final document. So are there any specific things that you think now, committee members, that you've already had an opportunity to read this, that we need to discuss in the growth category?
I do not have anything further.
Okay. The main area, I guess, to point out different than our last meeting was we talked about providing a category for technology and innovation. That growth metric was added for goals and objective, and then the metric was added to creation of a technology and innovation plan for NGH, as well as with the innovation and technology piece, the highest and best use for current innovative medical equipment and metrics to be provided by HAB on an ROI and break-even analysis. So really putting some teeth behind making sure that what we are using in terms of equipment and innovation are actually working and providing a rate of return on. The second category is financial leadership. Any discussion within this category, committee members? Okay. All right. Again, much of this is what we've already gone over. I, again, had asked Dr. Elders and even Dr. Blackledge as well to kind of lean in and add anything that they would have on this category. There wasn't really much changing here. Quality of care and customer service. This is the category where we blended both quality and customer service together under one. And there were a couple additions here, mainly with measurement criteria to define quality metrics. And we did add under, I think, Mr. Lester's comment back to Janet, an expansion of an increase in the number of preventative healthcare programs, specifically in the areas of diabetes prevention and heart healthy initiatives. So that was a change from this last meeting. Next area is employee excellence. Again, this was a revision and a new category, if you will, focused on creating and maintaining the culture of excellence for employees. Some of these, both goals and objectives and measurement criteria were in the last draft, but again, we're just under a different category. One of the major bullet points here, I think that should be noted is the goal of completing a hospital-wide salary and compensation analysis with implementation of succession planning across the organization. I think that's a very important thing that has not been done in a while. We want to make sure that we are always not just keeping our top talent, but also have a compensation program that will attract top talent. So I think that's an important piece. Last area of evaluation is board member and stakeholder relationships. This piece is something I know Mr. Lesser has always been focused on and feels like, obviously it's of vital importance to be transparent with the board. And I know he personally has led some initiatives to help with defining and creating a process in conjunction with leadership to help brand new board members come in and have a full experience and get to know the hospital in their first few months or two here. So appreciate your work on that, Mr. Lesser. I think we've added some language specifically about Nashville General Hospital Foundation in terms of making sure that we are working in conjunction with them to help establish goals, because as our luncheon yesterday would show, we have a lot of people who are excited to now be a part of that organization, some brand new membership, which we'll hear about later. And they are on board to the mission, how it supports this hospital, and we're really excited to see them kick off. That is it for the actual performance assessment form for fiscal year 25, 26. So we'll make that change here with this form. There is a scoring explanation on this form. If you feel like that is enough and clear, we'll be more than happy to pass it as is or move it to the full board for approval. If not, we can definitely add in an example if that would be helpful as well. So any comments, additions?
On that last point, and not really a comment, but I think there's a typo, which is we have said, and if you've discussed it or described it in the meeting, that it's the bonus percentage will be from 0 to 5%, and currently the summary evaluation says 1 to 5%. Yeah. There are going to be tranches, and I think we most recently awarded a 0% bonus in our last, and so I think it's intended to be 0.
That's correct. Yeah. And so then we would most likely, we would be moving that to 6 tranches instead of 5 in that case. So both of those would need to be amended in addition to the fiscal year's number on the first page, 25 to 26. Any further changes that you would recommend us make?
This is also a cosmetic change, but the heading of the current form is June 2024 to June 2025, and I wouldn't want historically for there to be any confusion. I think this is a 25-26 form.
That change is noted.
Okay, great. Thank you.
So we have that change plus the last page being 0 to 5%. Was that the only two?
And the 5 tranches being 6.
Okay.
And shouldn't it, on the front, adding to Mr. Escovel's point, shouldn't it be July 2025 to June 25?
Correct.
Okay. Any further edits or recommendations? Okay, seeing none, with those amendments, do I hear a motion to move forward with the CEO annual performance assessment form for fiscal year end 26?
Can I just make a comment?
Of course.
Madam Chair, I want to thank you and the other members of this committee who worked on this all year. Because if you recall, going through till about 6 months ago, we were about 2.5 years behind in the CEO assessments. And catching us up has been a bit of a challenge. It's been a lot of detail. It's been a lot of discussion, but we're here. And a lot of work, not only from the members of this committee, but Dr. Elders and Ms. Lester as well. And I just want to say thank you.
Thank you. Thank you. And this will be a more timely document going forward, and I think that will be the best way to provide guidance for and set expectations around what our board wants from a CEO, which is the best way for them to be able to move forward and drive the success of the hospital. So thank you so much. Yes, so do I hear a motion to, with the amendments as stated, do I hear a motion to pass the...
Moved?
Okay, is there a second?
Second.
Any further discussion? Seeing none, all in favor?
Aye.
Aye, motion passes. We will move this to full board for approval. Okay, that is it. So I will accept a movement to
I
adjourn.
move to adjourn.
Second.
Okay, thank you.